Welcome to today's comprehensive review on the gastrointestinal system. In this video, we will cover 50 of the most confusing and high-yield GI questions you must master for NCLEX, NGN, nursing school exams, and clinical assessments. Each question comes with clear rationales and smart test-taking strategies to strengthen your critical thinking and help you choose the safest answer. Make sure you watch this video till the very end, because the last set of questions are the trickiest and most commonly missed on exams. Let's dive in and get started. Question 1. A client with suspected peptic ulcer disease reports epigastric pain that improves after eating. Which type of ulcer does this suggest? A. Gastric ulcer. B. Duodenal ulcer. C. Stress ulcer. D. Esophageal ulcer. Correct answer, B. Duodenal ulcer. Rationale: duodenal ulcer pain often improves with food because the stomach acid is temporarily buffered. Strategy: pain relieved by eating equals duodenal, pain worsened by eating equals gastric. Question 2. A client with severe pancreatitis develops Cullen's sign. What does this indicate? A. Normal finding in pancreatitis. B. Superficial skin bruising from vomiting. C. Internal bleeding into the abdomen. D. Hypocalcemia. Correct answer, C. Internal bleeding into the abdomen. Rationale: Cullen's sign, periumbilical bluish discoloration, suggests retroperitoneal or interperitoneal bleeding. Strategy: Gray Turner equals flank bruising. Cullen equals umbilical bruising. Question 3. Which assessment finding in a client with liver cirrhosis indicates worsening hepatic failure? A. Spider angiomas. B. Fatigue. C. Asterixis. D. Jaundice. Correct answer, C. Asterixis. Rationale: Asterixis, flapping tremor, indicates hepatic encephalopathy due to rising ammonia levels. Strategy: Asterixis equals neurological decline equals emergency. Question 4. A client with ulcerative colitis suddenly develops abdominal distension, fever, and severe pain. What complication is most likely? A. Diverticulitis. B. Toxic megacolon. C. Hemorrhoids. D. Intestinal obstruction. Correct answer, B. Toxic megacolon. Rationale: UC complication characterized by colon dilation, fever, and severe pain. Life-threatening. Strategy: distended abdomen plus UC equals think toxic megacolon first. Question 5. A client with suspected appendicitis reports pain that moved from the umbilical area to the right lower quadrant. What does this indicate? A. Perforation. B. Normal progression of appendicitis. C. Bowel obstruction. D. Diverticulitis. Correct answer, B. Normal progression of appendicitis. Rationale: pain migration from periumbilical to RLQ, McBurney's point, is a classic sign. Strategy: RLQ pain plus rebound tenderness equals appendicitis. Question 6. A client returns from an endoscopy and begins vomiting bright red blood. What is the priority action? A. Give antiemetic. B. Notify the HCP immediately. C. Offer sips of water. D. Position in high Fowlers. Correct answer, B. Notify the HCP. Rationale: bright red blood, active upper GI bleeding, possibly from perforation or vessel injury. Strategy: post-endoscopy vomiting blood equals emergency call. Question 7. A client with chronic alcohol use presents with projectile vomiting, hypotension, and hematemesis. What is the likely cause? A. Gastritis. B. Esophageal varices rupture. C. Peptic ulcer. D. GERD. Correct answer, B. Esophageal varices rupture. Rationale: alcoholism is a major risk factor for portal hypertension, varices, massive bleeding. Strategy: alcoholism plus vomiting blood equals suspect varices first. Question 8. A client with gastric cancer has early satiety and weight loss. Which assessment finding supports tumor obstruction? A. Hyperactive bowel sounds. B. Succussion splash. C. Dry mucous membranes. D. Abdominal guarding. Correct answer, B. Succussion splash. Rationale: splashing sound on auscultation suggests retained gastric contents obstruction. Strategy: splash equals obstruction. Question 9. Which lab value is most concerning in a client with acute pancreatitis? A. Elevated amylase. B. Elevated lipase. C. Decreased calcium. D. Elevated bilirubin. Correct answer, C. Decreased calcium. Rationale: hypocalcemia indicates worsening fat necrosis in pancreatitis severe complication. Strategy: low calcium plus pancreatitis equals emergency. Question 10. A client with suspected cholecystitis has pain in the right scapula after eating a fatty meal. Which sign is this? A. Murphy's sign. B. Rossing's sign. C. McBurney's sign. D. Referred pain. Correct answer, D. Referred pain. Rationale: gallbladder irritation causes referred pain to the right shoulder or scapula. Strategy: fatty foods RUQ pain, think gallbladder. Question 11. A client with ulcerative colitis is having 12 bloody stools per day with worsening abdominal cramping. Which electrolyte imbalance is most likely? A. Hyperkalemia. B. Hypocalcemia. C. Hyponatremia. D. Hypermagnesemia. Correct answer, C. Hyponatremia. Rationale: excessive diarrhea leads to large sodium and water loss, causing hyponatremia. Strategy: UC plus diarrhea equals monitor sodium first. Question 12. A client with a GI bleed has BP 84/50 and HR 132. What is the priority? A. Administer antiemetics. B. Insert NG tube. C. Start 4 fluids. D. Give proton pump inhibitor. Correct answer, C. Start 4 fluids. Rationale: the client is in hypovolemic shock and needs rapid fluid resuscitation. Strategy: low BP plus high HR equals treat shock first. Question 13. A client with pancreatitis reports pain relief when leaning forward. What does this indicate? A. Cholecystitis. B. Pancreatitis. C. Gastric ulcer. D. GERD. Correct answer, B. Pancreatitis. Rationale: leaning forward reduces pressure on the inflamed pancreas. Strategy: pain relieved by leaning forward equals pancreatitis clue. Question 14. Which order should the nurse question for a client with acute diverticulitis? A. NPO. B. 4 fluids. C. Colonoscopy. D. Antibiotics. Correct answer, C. Colonoscopy. Rationale: bowel procedures can perforate an inflamed diverticulum. Strategy: never scope an inflamed colon. Question 15. A client with cirrhosis becomes confused and irritable. Which lab explains this? A. Sodium. B. Ammonia. C. Lipase. D. Hematocrit. Correct answer, B. Ammonia. Rationale: high ammonia levels cause hepatic encephalopathy. Strategy: mental changes plus cirrhosis equals check ammonia. Question 16. A client with PUD reports sudden severe abdominal pain and a rigid abdomen. What does this indicate? A. Gastritis. B. Constipation. C. Perforation. D. GERD. Correct answer, C. Perforation. Rationale: a rigid, board-like abdomen indicates peritonitis from perforation. Strategy: hard abdomen equals surgical emergency. Question 17. A client with hepatitis A asks when they are most contagious. A. Never contagious. B. When jaundice appears. C. Before symptoms appear. D. During recovery. Correct answer, C. Before symptoms appear. Rationale: hepatitis A is most contagious in the preicteric phase. Strategy: Hep A spreads before symptoms start. Question 18. Which food should a client with GERD avoid? A. Bananas. B. Tomatoes. C. Oatmeal. D. Chicken breast. Correct answer, B. Tomatoes. Rationale: acidic foods weaken the lower esophageal sphincter. Strategy: avoid acidic, spicy, and fatty foods. Question 19. A client post-gastrectomy becomes dizzy and tachycardic after meals. What condition is this? A. Hypoglycemia. B. Lactose intolerance. C. Dumping syndrome. D. Bowel obstruction. Correct answer, C. Dumping syndrome. Rationale: rapid gastric emptying causes fluid shifts and symptoms after food intake. Strategy: symptoms after meals equals dumping syndrome. Question 20. Which complication is most associated with Crohn's disease? A. Toxic megacolon. B. Fistulas. C. Bloody diarrhea. D. Rectal bleeding. Correct answer, B. Fistulas. Rationale: fistula formation is a hallmark of Crohn's disease. Strategy: Crohn's equals fistulas, UC equals bleeding. Question 21. Which assessment finding suggests bowel obstruction? A. Hypoactive bowel sounds. B. High-pitched tinkling sounds. C. Soft abdomen. D. Decreased abdominal girth. Correct answer, B. High-pitched tinkling sounds. Rationale: high-pitched sounds indicate trapped air and fluid in obstruction. Strategy: tinkling equals obstruction. Question 22. A client with severe vomiting is at risk for which acid-base imbalance? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Correct answer, B. Metabolic alkalosis. Rationale: loss of stomach acid through vomiting raises pH. Strategy: vomiting equals alkalosis/diarrhea equals acidosis. Question 23. A client on TPN has excessive thirst and polyuria. What should the nurse check first? A. Stop TPN. B. Blood glucose. C. Lipid levels. D. Urine protein. Correct answer, B. Blood glucose. Rationale: TPN often causes hyperglycemia. Strategy: thirst plus TPN equals check glucose. Question 24. A client with RUQ pain, fever, and pain on inspiration during palpation likely has A. Pancreatitis. B. Appendicitis. C. Cholecystitis. D. GERD. Correct answer, C. Cholecystitis. Rationale: positive Murphy's sign indicates gallbladder inflammation. Strategy: RUQ pain after fatty food equals gallbladder. Question 25. A client with cirrhosis has severe ascites and difficulty breathing. What is the priority? A. Elevate HOB. B. Daily weights. C. Give spironolactone. D. Measure abdominal girth. Correct answer, A. Elevate HOB. Rationale: ascites restricts lung expansion, airway is priority. Strategy: breathing always comes first. Question 26. A client with chronic pancreatitis needs which lifelong therapy? A. Vitamin C. B. Pancreatic enzymes. C. Iron supplements. D. Bile salts. Correct answer, B. Pancreatic enzymes. Rationale: the pancreas no longer produces enzymes needed for digestion. Strategy: steatorrhea equals give enzymes. Question 27. Which symptom indicates peritonitis? A. High-pitched bowel sounds. B. Rigid abdomen. C. Relief after eating. D. Red stools. Correct answer, B. Rigid abdomen. Rationale: board-like rigidity is the hallmark of peritonitis. Strategy: hard abdomen equals infection or perforation. Question 28. A client with black tarry stools is most likely experiencing bleeding from A. Lower colon. B. Rectum. C. Upper GI tract. D. Anus. Correct answer, C. Upper GI tract. Rationale: melena indicates digested blood from the stomach or duodenum. Strategy: black stool equals upper GI bleed. Question 29. Which food is safest for a client with diverticulosis? A. Popcorn. B. Nuts. C. Seeds. D. Cooked vegetables. Correct answer, D. Cooked vegetables. Rationale: low-residue foods reduce the risk of diverticulum irritation. Strategy: avoid nuts, seeds, popcorn. Question 30. A client with esophageal varices should avoid A. Walking. B. Sleeping flat. C. Weightlifting. D. Eating small meals. Correct answer, C. Weightlifting. Rationale: straining increases portal pressure and risk of rupture. Strategy: avoid activities that increase abdominal pressure. Question 31. Pale, clay-colored, stools and dark urine indicate which condition? A. Cirrhosis. B. Bile duct obstruction. C. GERD. D. Gastritis. Correct answer, B. Bile duct obstruction. Rationale: lack of bile into the intestine causes pale stools, bilirubin goes to urine instead. Strategy: clay stool equals bile blockage. Question 32. Which medication must be avoided in GI bleeding? A. Acetaminophen. B. PPIs. C. NSAIDs. D. Antacids. Correct answer, C. NSAIDs. Rationale: NSAIDs worsen gastric mucosal injury. Strategy: no NSAIDs for GI bleed. Question 33. A client with a small bowel obstruction is most likely to have A. Constipation only. B. Severe vomiting. C. Ribbon-like stools. D. Painless bleeding. Correct answer, B. Severe vomiting. Rationale: SBO causes early, persistent vomiting. Strategy: upper obstruction equals more vomiting. Question 34. Which position helps reduce GERD symptoms? A. Supine. B. Right side. C. Left side. D. Trendelenburg. Correct answer, C. Left side. Rationale: left lying reduces gastric reflux into the esophagus. Strategy: GERD equals sleep on the left. Question 35. What isolation should be used for a client with C. difficile? A. Airborne. B. Droplet. C. Contact. D. Protective. Correct answer, C. Contact. Rationale: C. diff spreads via spores requiring contact precautions. Strategy: hand washing only, no alcohol sanitizers. Question 36. What is often the earliest sign of colon cancer? A. Severe pain. B. Iron deficiency anemia. C. Weight loss. D. Constipation. Correct answer, B. Iron deficiency anemia. Rationale: chronic occult bleeding causes anemia before other symptoms. Strategy: unexplained anemia equals colon cancer warning. Question 37. A client with acute hepatitis should avoid A. Rest. B. Carbs. C. Alcohol. D. Fluid intake. Correct answer, C. Alcohol. Rationale: alcohol worsens liver damage. Strategy: absolute no alcohol with hepatitis. Question 38. Which lab is most specific for pancreatitis? A. ALT. B. Lipase. C. LDH. D. Ammonia. Correct answer, B. Lipase. Rationale: lipase remains elevated longer and is more specific than amylase. Strategy: lipase equals pancreatitis. Question 39. Fatty, foul-smelling stools indicate dysfunction of which organ? A. Liver. B. Pancreas. C. Kidneys. D. Stomach. Correct answer, B. Pancreas. Rationale: pancreatic insufficiency causes steatorrhea. Strategy: greasy stool equals pancreatic problem. Question 40. Before paracentesis, what is the priority? A. Give diuretics. B. Weigh the client. C. Empty the bladder. D. Check potassium. Correct answer, C. Empty the bladder. Rationale, reduces risk of bladder puncture. Strategy, paracentesis equals empty bladder. Question 41. An NG tube stops draining. What should the nurse do first? A. Remove it. B. Reposition the client. C. Increase suction. D. Call the provider. Correct answer, B. Reposition the client. Rationale, movement may correct tube placement. Strategy, reposition flush reassess. Question 42. Which vitamin is deficient after gastric surgery? A. Vitamin A. B. Vitamin B12. C. Vitamin D. D. Vitamin K. Correct answer, B. Vitamin B12. Rationale, loss of intrinsic factor causes B12 deficiency. Strategy, post-gastrectomy equals lifelong B12. Question 43. A client with persistent diarrhea is at risk for which imbalance? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory acidosis. D. Hyperkalemia. Correct answer, B. Metabolic acidosis. Rationale, diarrhea causes bicarbonate loss. Strategy, diarrhea equals acidosis. Question 44. A client with cirrhosis has bruising and petechiae. Which lab explains this? A. High bilirubin. B. Low platelets. C. High lipase. D. Low potassium. Correct answer, B. Low platelets. Rationale, splenic enlargement traps platelets thrombocytopenia. Strategy, bleeding equals check platelets. Question 45. Which complication is common with an ileostomy? A. Constipation. B. Dehydration. C. Obesity. D. Fecal impaction. Correct answer, B. Dehydration. Rationale, ileostomy output is liquid fluid loss. Strategy, monitor sodium and potassium. Question 46. A client with gallstones has pain after eating fatty meals. What causes this? A. Gastric acid secretion. B. Gallbladder contraction. C. Pancreatic spasm. D. Intestinal gas. Correct answer, B. Gallbladder contraction. Rationale, fat triggers gallbladder contraction stone blockage pain. Strategy, fatty meals equals gallbladder attack. Question 47. Which supplement is essential for a client with chronic alcohol abuse? A. Calcium. B. Thiamine. C. Vitamin E. D. Folic acid. Correct answer, B. Thiamine. Rationale, prevents Wernicke's encephalopathy. Strategy, alcoholism equals give thiamine before glucose. Question 48. Which symptom is typical of a small bowel obstruction? A. Ribbon-like stools. B. Frequent vomiting. C. Painless bleeding. D. Pencil stools. Correct answer, B. Frequent vomiting. Rationale, SBO causes early, persistent vomiting. Strategy, upper obstruction equals vomiting. Question 49. Barrett's esophagus increases the risk for A. Colon cancer. B. Esophageal cancer. C. Liver cancer. D. Pancreatic cancer. Correct answer, B. Esophageal cancer. Rationale, chronic GERD causes cell changes, Barrett's, that may become cancerous. Strategy, GERD Barrett's cancer risk. Question 50. A client with suspected peritonitis is most likely to have which vital signs? A. Low HR and low temp. B. High HR and fever. C. Normal vitals. D. Low HR and high temp. Correct answer, B. High HR and fever. Rationale, infection and inflammation cause tachycardia and increased temperature. Strategy, infections equals HR plus fever. Great job completing all 50 challenging GI questions. I hope you watched until the end, because every question, especially the last few, was designed to boost your exam confidence and clinical judgment. If you found this video helpful, don't forget to like, share, and subscribe for more high-quality NCLEX practice questions and nursing tutorials. Keep studying, keep practicing, and stay committed to your nursing journey. See you in the next video.